Excellent. So at this time, I'd like to introduce both Katie, did Katie and Chris are both on, correct? And what we're going to ask you to do is Tracy will unmute you. You can bring your camera up, and we'll start with Chris since he brought his camera up right away.
Yeah. Can you hear me, Matt?
Yeah, sound
Okay,
great.
good morning. As Matt said, I am a regional director at Delphi Village, and if you aren't aware, we provide residential services. In addition to a number of community-based services, we provide residential services to youth in need. So we deal with a lot of at-risk youth. Obviously, there's a need for drug and alcohol and substance abuse. Through working with Gateway, we've partnered with them for at least 5 years that I know about. They used to have clinicians on site with us. And then, as Dr. Diallo mentioned in her opening remarks, we really ran into a shortage of being able to have clinicians here on site. So it really opened the door for the telehealth services. Um, I can't say enough about Gateway. It's going to sound like I'm a paid spokesman. I assure you I'm not. Matt and his team really did a great job with us. Dr. Diallo also mentioned the word impressive when referring to Matt. That's not exclusive to Matt, although he is super impressive. His team really worked hard and extensively to really make this happen for us. It's a great program. It's a great partnership. It's a great service that they provide to us. I feel like we're really on the winning end of it. Um, it's I hope it's not one-sided, but what they do for us is I can't even speak enough about it. I have a short window here to talk about it, but I really could talk at length about what this program means to our services. We rely on it. The counties we serve rely on it across the state of Pennsylvania. So it really is important. The folks are patient, they're responsive, and they really care. So the referral process has been made very easy for us. You mentioned Stephanie's on the call. Her clinical team does a great job. The evaluation services through Rachel and Sarah. I don't know if folks know them, but they're great too. I've never heard any of them say no. We speak often. We get on a call at least once a month and troubleshoot. There's been a lot of growing pains. This was a heavy lift. Um, we've, in addition to those monthly calls, Matt and his team have come on site here. Once Matt kind of figured out that when he talks about technical things, I kind of go blank in my eyes. There's nothing behind them. He quickly realized that he needs to work with some technical folks. So he really looped in our internal IT department here at Adelphi to make sure things were set up. There's obviously a lot of regulatory compliance. There is on my end, there's on Gateway's end as well, especially with this being the first approved telehealth service. It like I said, it's a heavy lift, and to make sure everything works and works appropriately, it took a lot of time and patience, and that's probably again more on Matt and his team's end. They really kind of set this up and knocked it out of the park for us. And again, there's been, I mentioned the growing pains along the way. There's been a lot of things that pop up, mostly on the technical side. Obviously, Matt is very well versed in the regulatory governing bodies that oversee him and me on my side. So we were very aware of those, but the technical things were sort of difficult in the beginning. And I say that, maybe Matt says otherwise, but again, I don't know the technical world like he does. So it really got to a place to where we're very comfortable. There is maintenance that needs done with these types of things, and that's probably the nature of the monthly calls that we have. So we really do continue to troubleshoot and keep an eye on things. We are in the process of getting groups off the ground for the kids that we serve. That's a tall task as well. But again, you don't hear no from the folks at Gateway. It's we'll figure it out. We'll figure out a process and a workflow that makes sense and that fits and that is agreeable to everybody and is in line with everything that we need to do to check boxes to make sure regulations are followed. So I can't I can't speak highly enough of the organization. Just growing with our relationship with them. I hope it continues and continues. We have anywhere from 200 to 250 kids in care at any given time. And, you know, we have kids that come in and they're within a program for 6 to 9 months, maybe a year. And at any point during the programming with us, they can kind of jump into substance abuse, which is very prevalent. So, um, it's been a blessing for us, and I hope that other folks understand that even though it might seem like it's not something that you can do, they Matt and his team really made it easy for us. So sort of where I'll end my little glorification of Gateway.
Thank you, Chris. Thank you, Chris. I think we unmute. Thanks, Chris. I appreciate that. Yeah, it's a partnership, and we are very, very aware of compliance and regulations, but it's a group. The evaluation team, I'm glad you mentioned Rachel, Sarah Convey, our telehealth evaluator, Chuck, who helped your staff with setting up the kiosk and the coordination of your team. So we thank you, and I couldn't do anything without. It's not me. Stephanie's running the program. So without Stephanie and Adrian and Ashley and Dana, it's just such a wonderful opportunity. As long as the lights stay on, we stay connected. That's what I say. So great job, Chris. Appreciate you.
Thanks, Chris.
And next, I'd like to move to Miss Katie Gruber from the Nurse Health Professionals Group out of Harrisburg. Katie, we're going to spotlight on you and unmute you. Can you hear us good? All right, go ahead. The floor is yours.
So I'm Katie Gruber. I work for the Peer Assistance Monitoring Programs. I'm the Billing, Data, and Training Manager. I've been with them for 10 years. The whole 10 years I've been there, we've actually worked with Gateway. And a little over, almost 3 years ago now, we took over monitoring nurses, and we noticed that there was a hole. And part of that was intensive outpatient, and it had always been a hole for us. What would happen is we expect our participants to go to healthcare professional treatment. And when they do that, if IOP was recommended, if they were in certain areas of the state, they didn't have that access. So in working with Gateway, that has been a tremendous help for us. Specifically with the nurses and now also with the physicians, we've been able to reach participants that we wouldn't have been able to reach previously, which is amazing. One of the other big things is that how Gateway is working with Medicaid. With some of the populations that we're working with, their financial limitations are greater than what we have previously encountered. So the fact that Gateway is working with a lot of insurances and Gateway is working with Medicaid and getting approval in so many different counties is great for us and tremendous for us. And is one of the reasons why we're looking for insurance approval. So it's very important to us. Another thing is that with our participants, we hear a lot of positive feedback. Our staff loves working with Gateway, and they are talking about the constant positive feedback that they hear from participants. Again, I can't say anything negative. It's been a great experience. The biggest thing for me is just the accessibility, not just to the treatment, but also the financial accessibility. With the fact that we're being able to have participants enter into treatment that previously we wouldn't have been able to because of the fact that Gateway is working with so many different types of insurances.
Thank you. Thank you, Katie. I appreciate that. And we couldn't do anything without Kara Schultz as well. She's the primary evaluator for this group, and of course the whole team behind it. But yeah, this relationship was built. You came to us with a need, and once we got the 100% the telehealth only license, it opened up that middle of the state. That slide that you showed going across the state, I couldn't agree with you more, Katie. The care desert between the locations, and I've shared with you, and Dr. Diallo is going to share the patient satisfaction and the feedback data that we have for you, but I still remember the one day I took a call and the patient was being referred from you guys to us. And this is what makes us keep going and why we're all doing this from a mission purpose. She said, hey, I was referred, went through an assessment with her so we could refer her over to Katie, Kara Schultz. And she goes, can I do this from home? And I said, yes, if you have X, Y, and Z. And she said, thank God. And then she started I could hear her cry. I could hear her, but it wasn't like cry. It was just a relief. And then I heard her child in the background. And here is somebody for our workforce that we need, nurses. And I was just like, I was moved from that moment. I still get hair, on the back of my neck when I tell that story, that I heard her relief that she had access. Now, we still had to find out if their insurance would be taken. There are certain counties that still don't recognize telehealth, and we're going to do our job to make sure that they do. But this person was served, and I thank my team, Dr. Diallo and Katie, for making that happen. So those stories keep us going. Thank you, Katie.
Thanks, Katie.